Has the rehab process after ACL surgery gotten faster over the years? I'm Dr. David, orthopedic surgeon and sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. And I provide education, information, and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. We talk about ACL injuries a lot. There's about anywhere from 100,000 to 200,000 ACL reconstruction surgeries performed just in the United States every single year. It's a lot of athletes and active people trying to get back to sports and back to exercise. Now, it's not a quick process. It never has been. Right now we kind of tell people it's about minimum about 6 months back to sports, but a lot of times 9 to 12 months or longer. But the process has changed a lot. The process of getting back to sports has changed a lot over the years. And I think it's worth seeing where we were to talk about where we're going. So I think, if you're in your, let's probably say 50s and 60s, and you suffered an ACL injury, you probably remember how it used to be, where whether or not they did surgery, but even if they did, they put you in a cast with your knee bent and basically tried to protect that repair or that reconstruction to get it to heal. The problem is that led to a fairly stiff knee. So you gain stability at the expense of stiffness. And so you never really got back to play at the level you were. That was why very often just that ended people's careers. But around the time of the 1980s, there was a push for accelerated rehab because athletes did want to get back. They didn't accept that that's all they could do. And it wasn't just him, but Dr. Donald Shelbourne in Indianapolis started to really look at ways to accelerate the rehab process. So they got rid of the casts after surgery. They started using a machine to help bend the knee, which we've gotten away from a little bit, but that really started moving the knee quickly. We started really pushing to get the knee flat right away and start bending the knee right away, allowing weight bearing right away. And I tell the interesting story about how Dr. Shelbourne says a lot of how he figured out that that was okay and good was that patients weren't really listening to his instructions, and he said, well, there must be something to maybe not doing that and why they're doing better than the people that were following his instructions. So this accelerated rehab process started. Now, what that entails in sort of the bigger picture sense now is after surgery, it's an outpatient surgery, we make a new ligament. Some surgeons push people to wear a brace for a certain amount of time, some don't, but you work on getting knee range of motion back really quickly, getting it all the way flat and bending it, and that process takes about 4 to 6 weeks. You're trying to start to develop strength, especially quad strength, very early on. You're getting your ability to walk on it back. You're still not jogging, but at least you're doing things to get your motion and strength back. So maybe riding a stationary bike, it may be some leg presses on a leg press machine, things like that. And there's a lot of other ways to do it. Now, once you get to a certain amount of knee motion and knee strength back, yeah, they start more functional things. Around 10 to 12 weeks, maybe you start jogging. Once you get to a certain level, then you progress to more agility things, landing on it, pushing and turning off on it, doing ladder drills, things like that. More high-level strengthening type of things. And then it goes into sort of a sport-specific return to sports phase and ultimately get back to practice and get back to sports. But again, that process is long. 4.5 to 6 months minimum, but a lot of times you're looking really more at 9 months, maybe even 12 months. And we'll talk about soon, even then sometimes patients have a fear of re-injury and a fear of not being confident on their knee, and that's a real phenomenon as well. But I will tell you, even with our current success rates, 2/3 or so of athletes get back at the same level of play by a year after surgery. That's still a lot better than it was in the early 1980s and 1970s. At least now you have a chance to get back to play. Have you suffered an ACL injury? And Have you gotten back to play at the level you were? What was the rehab process like? I would love to hear your experience. So below this video, share how it went for you. I'd love to read it, and I know a lot of other people would too. If you like videos like this, basically subscribe to my video channel. Click the button in the upper right corner of the YouTube page. I record a couple of these videos every single week, and they'll get delivered directly to you. And if you want to hear the story of where we were and where we're going with ACL recovery and return to sports, get a copy of my book, That's Gotta Hurt, The Injuries That Changed Sports Forever. There's a link to tghbook.com where you can learn more about the book and get some bonus content for free if you order the book, and you'll find out much more about it. I'm really proud of the message, not just for sports fans and some of the injuries that really impacted pro and college sports, but the effects it's had on youth sports, on adults that play those sports, people that just like to exercise, how it's affected orthopedic surgery and sports medicine. I think it's really important, and I'd love to share that with you. Thank you so much for watching. I look forward to seeing you right here next time.